Dialysis. Types. Risks. Alternate. What is dialysis? Hello friends, today we will talk about the dialysis. The kidneys filter your blood by removing waste and excess fluid from your body. This waste is sent to the bladder to be eliminated when you urinate. Dialysis performs the function of the kidneys if they've failed. According to the National Kidney Foundation, end-stage kidney failure occurs when the kidneys are performing at only 10 to 15% of their normal function. Dialysis is a treatment that filters and purifies the blood using a machine. This helps keep your fluids and electrolytes in balance when the kidneys can't do their job. Dialysis has been used since the 1940s to treat people with kidney problems. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one healthcare. Please also like, share and leave a comment below. Why is dialysis used? Properly functioning kidneys prevent extra water, waste, and other impurities from accumulating in your body. They also help control blood pressure and regulate the levels of chemical elements in the blood. These elements may include sodium and potassium. Your kidneys even activate a form of vitamin D that improves the absorption of calcium. When your kidneys can't perform these functions due to disease or injury, dialysis can help keep the body running as normally as possible. Without dialysis, salts and other waste products will accumulate in the blood, poison the body, and damage other organs. However, dialysis isn't a cure for kidney disease or other problems affecting the kidneys. Different treatments may be needed to address those concerns. Types of dialysis. There are 3 different types of dialysis. Hemodialysis, peritoneal dialysis, continuous renal replacement therapy, CRRT. Risks associated with hemodialysis. Hemodialysis risks include low blood pressure, anemia, or not having enough red blood cells, muscle cramping, difficulty sleeping, itching, high blood potassium levels, pericarditis, and inflammation of the membrane around the heart, sepsis, bacteremia, or a bloodstream infection, irregular heartbeat, sudden cardiac death, the leading cause of death in people undergoing dialysis. Risks associated with peritoneal dialysis. Peritoneal dialysis is associated with an increased risk for infections in or around the catheter site in the abdominal cavity. For example, after catheter implantation, a person can experience peritonitis. Peritonitis is an infection of the membrane lining the abdominal wall. Other risks include abdominal muscle weakening, high blood sugar due to the dextrose in the dialysate, weight gain, hernia, fever, stomach pain. Risks associated with CRRT. The risks associated with CRRT include infection, hypothermia, low blood pressure, electrolyte disturbances, bleeding, delayed renal recovery, weakening of bones, anaphylaxis. Are there any alternatives to dialysis? Dialysis is time-consuming and expensive. Not everyone chooses it, particularly if they're experiencing severe, acute kidney failure. If you decide not to pursue dialysis, there are other treatment options that may help manage your symptoms. One of these options is anemia management. When the kidneys are working properly, the hormone erythropoietin, EPO, is produced naturally in the body. To help with an under-functioning kidney, you can get an injection of EPO every week. Maintaining good blood pressure can help slow the deterioration of your kidney. Drink fluids to avoid dehydration. Talk to your doctor before taking any anti-inflammatory drugs, including ibuprofen, Advil, and diclofenac, Solaraze, Voltaren. A kidney transplant is another option for some people. It's also a long-term commitment. Talk to your doctor to see if a transplant is right for you. You might not be a good candidate for a kidney transplant if you smoke, heavily use alcohol, are obese, have an untreated mental health condition. Long-term outlook for someone who needs dialysis. Not all kidney disorders are permanent. Dialysis can temporarily serve the same function as kidneys until your own kidneys repair themselves and begin to work on their own again. However, in chronic kidney disease, the kidneys rarely get better. If you have this condition, you must go on dialysis permanently or until a kidney transplant becomes an option. Lifestyle changes are required as well. Your nephrologist, kidney doctor, should have a dietitian on their team to help guide dietary choices. While on hemodialysis, limit your intake of potassium, phosphorus, and sodium. This includes sodium from vegetable juice and sports drinks. You'll want to keep a record of how much liquid you consume. Having too much fluid in the body can cause problems. Some hidden sources of liquids include fruits and vegetables, such as lettuce and celery. Being consistent with your dialysis will decrease your chances of needing a kidney transplant. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one healthcare. Please also like, share and leave a comment below.